I'm Barbara Markham, the Director of the Senior Resources Department, City of Westland. As you might recall, we had Dr. Michelle Akler at the studio talking a little bit about eye health. Well, shame on me. It's been 20 years since I've had an eye exam myself. So today we're doing a special edition of Health Matters on the Road. I'm here to go through the whole gamut of an eye exam that's long overdue. Why don't you join me? Hi, I'm Barbara Markham. I'm here for my appointment.
Hi, Barbara. Welcome to the office.
Thank
I
you.
have some paperwork for you to complete.
All right.
There's a pen on top. Just bring it up when you're done.
Okay, thank you.
You're welcome. Thank you.
Barbara, good morning.
Morning.
Come on back.
Are we ready?
We are.
All right.
I am. How about you?
I think as ready as I'm going to be.
Well, we're going to go all the way down the hall.
Alrighty.
And straight ahead to the open door there for me, please.
Okay. We're in the exam room now with Roxana. I'm getting ready to have my vision tested. I can already tell you I'm blind as a bat. And it started when I turned about 40. Is that normal?
That can be normal. Did you lose the up-close vision?
Yes, it was reading.
Yes.
And then the cheaters began, and then they just got stronger and stronger. So now I thought it's time to come in.
Absolutely, and we can ease your mind. The good thing about that is that's very normal. At about the age of 40, you lose the availability to accommodate up close, and so that's where those nice little reading glasses come in. So
I have 1,000 pairs. I tuck them away everywhere.
the dollar store's your best friend?
Oh, yes, dollar store, yes, CVS. I go to all the pharmacies and try on the different styles.
Excellent. Okay, so Barb, again, my name's Roxanne. I'm the technician for Dr. Akler. I'm going to get you started. We're going to go through and do a bunch of things, and then eventually we'll bring Dr. Akler in to take a look at you, okay?
All right.
So I'm going to take a minute just to look over your medical history.
Sure.
But while I'm doing that, why don't you tell me, when was the last time you had an eye exam?
I don't even remember, but I know it's been 20 years.
Okay. And Barbara, how old are you now?
I would be, well, I'm turning 56 on, what, 3 days?
Okay.
Labor Day.
So right now we'll still say you're 55?
Yeah, please.
Okay, excellent. All right, so about 20 years for your last eye exam. Mm-hmm. So you're just a short period overdue?
Yes, actually, as the cheaters took care of, I had no pain or any other symptoms, so I thought, well, the cheaters will do. But then as I'm getting older, I know with glaucoma there rarely is any pain. Since my mom has glaucoma, I thought I need to make sure that I don't have any of those, the macular or the glaucoma.
Okay. So I also see that you're a diabetic.
Well, actually, I was diagnosed with type 2 diabetes, and I've lost a lot of weight in the last year or 2 or 3. So I'm still on metformin, but it's really not an issue. My sugar is well under control now.
Okay. Now, was your the doctor that's following you for the diabetes, were they on you to get an eye exam, to
She
get a
did
dilated
say that,
exam?
yes. Make sure you have your eyes checked.
Okay. Now, visually speaking, tell me what's going on with the eyes.
Okay. It seems like my right eye is weaker than my left eye is. I don't have any problem really seeing distance-wise, but it's a little bit blurry, but especially close up. I can't even begin to read the phone book.
Okay. And so you said that you're using some over-the-counter readers. What
Yes.
strength are you using right now?
250.
Okay. And do you feel like those are working okay for you?
Yep, they work just great.
Okay. All right, so I see that you have some family history of the glaucoma, and I think you had mentioned that it was your mother that has the glaucoma?
Yes.
Okay, and when was she diagnosed with the glaucoma?
She was diagnosed probably, I'm guessing, 30 years ago.
Okay. And and it was your dad that has the macular degeneration?
Yes.
Okay.
It's dry right now.
Okay.
And actually, it's getting better.
Okay.
Believe it or not, he's been doing the Ocuvite and some of the eye vitamins,
Okay.
and it's really helped somewhat.
Good. It's really important for him to maintain those, and also that they're finding with the macular degeneration that it is more of a family thing where it can be passed down from generation to generation. Are you using any vitamins?
Actually, I started taking the Ocuvite probably a year ago.
Okay.
And have been taking that as part of my regular routine.
Okay, excellent. That's a good idea. And just because, again, studies have shown that it is more, related and passed down from family member to family member, and you can help prevent and slow some of the progression down by pre-treating. So that's good.
Okay.
So that was a good step there. Okay, so what we're going to do now is we're going to take a peek at your vision and see how that's doing, okay? So the first thing we're going to do, I'm just going to kind of, refresh your memory because it's only been a few years since your last exam.
Oh, only a few.
I'm going to refresh your memory on how we're going to do this, okay? So I'm going to have you put that hole over your right eye for me.
Okay.
And what I want you to do is look straight ahead in that screen there. You're going to see a bunch of letters up there.
Yes.
And I'm going to turn the lights down a little bit here.
All
I want
right.
you to blink a couple times for me.
All right.
And while looking straight ahead there, what's the smallest line that you can comfortably read up here?
Comfortably read? Well, the FZ, and then I can see some of the letters on the following line.
Okay, let's read the line above the FZ.
Okay, E, G, N, U.
Very good. Now, do me a favor. I want you to turn that over to your other eye for me.
Okay.
Good. I want you to blink a couple times.
Okay.
And same thing, looking straight ahead here, I want you to tell me the smallest line that you can read up there.
Okay, that would be the FZ line again.
Okay.
And then, but I can see some of the letters underneath that also.
All right, let's look at the FZ line. Can you read all 4 letters in that line?
Yes. FZ, I don't know what that third one is. It looks like a B.
It is.
Okay. And then looks like a C or a G.
Okay, good. You can go ahead and relax. All right.
Yeah, it's blurry.
And let me take that for you. Good. All right.
Is there any reason? I remember this one is one thing I do remember. The eye chart used to be on the wall, not through the mirror. Is there any particular reason that you do that?
Modern technology. It's always evolving.
Okay.
This is what happens when you don't go to the doctor in 20 years. See, we get mirrors.
Yeah, I noticed that. It's a little bit different.
No, but you know what we do is in our facility, the rooms actually, when we're checking vision, it has to be like at a 20-foot, range. And obviously this room is not 20 foot long.
Okay.
So what we do is we project it so it looks like it's actually 20 foot long.
see.
So at most facilities, you'll find when they have the wall chart that they make you stand 20 foot away from that. All right, so we're going to do a few more things here, okay? So what we're going to do now is I'm going to take a look at your eyes and how the muscles work. So what I need you to do is look right at the tip of my pen for me, okay? I'm going to move this around, and I need you to follow it with just your eyes and don't move your head, okay?
All right.
That's good. So we're just making sure that the muscles are all working really well. As we get a little bit older, the muscles have a tendency to kind of weaken a little bit, and the eyes can turn in or out, but so far they look good. All right, so now what I'm going to have you do is take your left hand and cover your left eye for me. You can, yeah.
No, I'm just kidding.
Okay, so what I want you to do is I want you to look right at my nose for me, okay? I'm going to move my hands around out here. I don't want you to look anywhere but right at my nose.
Okay.
And how many fingers?
2.
And here.
1.
And here.
5.
And here.
2.
Good. Now, uncover your left eye. Yep, exactly. Blink a couple times. Same thing. I want you to look right here.
Okay. 1. 5. 2. 5.
Good. All right, you can go ahead and relax. All right, so now I'm going to reach right in front of you. And what I want you to do for me is I want you to look straight ahead, okay? And what I'm going to do now is I'm just taking a look at your pupils, okay? So you just look straight ahead.
All right.
And this is kind of a bright light here. That's good. And what I'm doing is I'm just making sure that the pupils are reacting properly and opening and closing good. They look great. Okay, so now what I'm going to do is I'm going to check your prescription here for the glasses, okay?
Okay.
So this looks like a big machine, but I promise it's not going to hurt you in any way, shape, or form.
Yeah, I'm not good with pain.
Okay.
That's why I avoid doctors, any kind of office at all.
Well, the good news is that we don't inflict any pain
Okay,
here.
well,
So.
I'm good with that.
All right. So this is just like a big pair of glasses, okay? So what I'm going to do is I'm going to bring this in front of you, and I have your left eye closed.
Okay.
And we're going to start with your right eye.
All right.
And there's a bunch of, dials in here. I'm just going to change all those, and you're
Okay.
going to tell me if it gets better or worse, okay?
All right.
All right, so. And 2 or 3.
2,
All right. 4 or 5.
5,
6, 7.
6,
All right. Blink a couple times. Here's 8 and 9.
9.
Okay. 2, 3.
Let's see, 2 again.
2.
2.
All right. Okay, blink a couple times, and again, smallest line you can read up here.
That would be the bottom. It looks like EVOTZ.
Excellent. All right, I want you to blink a couple times. Now I'm going to open both eyes, and I want you to tell me, how does that look for you?
Wow, amazing.
All right. So
It's very clear.
Okay, so you can see the bottom line there, correct? All right, so
Yes.
looking at the bottom line, do you think it looks better the way you see it here or there?
I feel like I'm blind.
Exactly.
That's
Okay. So I'm
exactly
yeah. So
I am.
I'm definitely picking up. I'm definitely picking up. You know, a mild prescription for distance.
Okay.
So you know, getting a pair of glasses to help. You know, it's going to make life easier for you.
Okay.
So all right. So Barbara, I have a couple of eye drops for you. Okay.
All right.
There's a Kleenex for you, and I'm going to have you look up towards the ceiling.
Okay.
So this first drop that I'm going to put into your eye here, this is a numbing drop. Okay. So this may sting just a little bit.
Okay.
And you can blot your eyes.
Is there any reason that you numb the eye? We're not getting needles in the eyes or anything, are we?
No, we haven't progressed that far yet, but what I'm going to do is I'm going to put a little dye in the front of the eye. I'm going to have you look up towards the ceiling for me, okay? So this is a little bit of orange dye, and the reason that we numb the eye is because I'm going to check the pressure in your eyes. That's the glaucoma test, okay? So we don't use that air puff test that you find at a lot of your,
Do I
you know.
look weird like a monster?
No.
I mean, like, you know how they, like Thriller and
No.
with the dye? Okay.
No, you can go ahead and blot your eyes.
All right.
All right, and
Ooh, they're yellow.
yes, they are. All right, so Barbara, I'm going to turn the lights down a little bit here.
All right.
And what I'm going to do is I'm going to bring this machine around in front of you.
All right.
And what I'm going to have you do when you're
Can
ready.
I look straight ahead? It
Yes.
won't run out or anything,
No,
will it?
no, you're good.
Okay.
What I would like you to do is come on forward and put your chin right in the chin rest here for me. And forehead all the way forward. That's good. All right, so what we're going to do here is I'm just going to take a look at the front of your eye here real quick.
All right.
And this is kind of a bright light, so just kind of bear with me for a moment.
All right.
And hold it right there, open nice and wide. That's great. And so, Barbara, what I'm doing is I'm just taking a look at the front of the eye, at the cornea here.
All right.
Making sure there's no problems, making sure that you don't have anything stuck in there. Good, hold it right there. Okay, so you see that blue light right there in front
Yes.
of you? Good, what I need you to do is look right at that for me, okay? I want you to keep your eyes open nice and wide.
All right.
I want you to listen to your breathing. I'm gonna help you open up a little bit here. The blue light's gonna come in pretty close, okay? You're not gonna feel anything. That's the beauty of that numbing drop that I gave you. And you hold it right there, that's perfect. Good, and blink a couple times. And I'm gonna do the same thing to the other eye here, okay? And hold it right there, good. Listen to your breathing. Great, go ahead and sit back. All right, see, that wasn't bad.
No. Now,
Yes.
was that for the glaucoma?
That was.
Well, what happened? When did they do? Now, I did have the puff test where they puff the air into your eyes.
Yes.
When did they replace that?
Well, again, a lot of your optometry offices still have that, you know, the air puff test. The ophthalmologists, we have, you know, this particular measurement. This is more accurate than the air puff.
Okay.
And the reason is that this is actually touching the front of your eye. And in the air puff, as you know, you've had it before. When you're sitting there, you're anticipating that's coming at you.
Yeah, so you
you can kind
yeah.
of back away a little bit, and it's still going to take a measurement. This won't happen. So.
All right. That actually touched my eye?
It did.
Really? I
Yes.
didn't even feel that.
See, that was the beauty of the numbing drop. So we give you the numbing drop so that you can't feel that.
All right.
Okay? And what I'm going to do now is I have 2 more drops. Now these are the dilating drops, okay? So it's been a while since you've had your eyes dilated. So what's going to happen is I'm going to put the drops in. We're going to let you sit for about 10 or 15 minutes.
All right.
That's going to allow the eyes to dilate.
All right.
And then, you know, Dr. Akler will come in and do her portion of the exam. All right, I'm going to have you look up towards the ceiling for me.
Okay, now there are 2 different drops. What are they?
There are 2 different drops, and they
Yes.
both serve a different purpose.
All right.
And they're both designed for dilating the eyes. You'll find that a lot of offices may use different types of drops. We in general ophthalmology, we don't have to use, some of the dilating drops that like a retina specialist would have to use, where they're
Yes.
stronger and you're dilated a lot longer and things like that.
Okay.
But we do need the eyes dilated adequately, so when she comes in and she shines that bright light in your eyes, that the pupils don't close down.
Okay.
So that's why we need both of them.
Fine.
Okay.
Yes.
All right.
This has actually been very interesting.
It is.
Not too scary.
No.
And not painful at all.
See? You can relax.
I know.
Breathe easy.
All right.
All right.
I'm good.
Yes. So about 10 or 15 minutes, and then
Okay.
we'll pick up where we left off.
Great.
All right.
Thank you, Roxana.
You're welcome.
Moving on to the second phase of the examination, I'm joined now with Dr. Michelle Akler. Where are we going from here, Dr. Akler?
Well, so far, everything is going great with your examination. I'm going to review with you what we've done so far.
Okay.
And then I'm going to examine your eyes for their health.
Okay.
All right.
Let's get started.
Good. So far, so good. Your vision was great. Need a little help with the glasses now, which,
Yes.
is common. So don't feel badly, especially for the readings. This is normal stuff.
Okay.
After we all turn, the more we are over 40, really, the worse it gets.
Now, when with presbyopia and the is it the lens that becomes less flexible?
That's right.
Okay, and it's more difficult to see?
More difficult, especially to focus up close. The lens gets stiffer inside the eye, and so it needs some help with usually over-the-counter reading glasses just to help focus things better up close.
Okay, and does that ever change? Do you get to a certain point where with the cheaters where they just kind of level out your vision, or does it continue to get worse?
Barb, it does stop usually by the time people are 60 to 65. It's usually as bad as it's going to get. And the over-the-counter readers range in strength from +1 to +3. So once you've gotten to +3, that's usually as high as they go.
Right, exactly. Now, is there any surgery that's available to replace lenses? Would that help at all? Are they looking at that, like long term, for any kind of corrective vision?
Yeah, that's a great question. There are some procedures where we do lens replacements and use specialized lenses that correct the near and distance vision. They can be used to correct the reading vision. It's a more aggressive procedure when it's done in people whose eyes are healthy. But commonly with cataract surgery, we also recommend lenses that correct the near and the distance vision. So in that situation, you're getting rid of 2 problems at the same time.
Wonderful. Now, when you do surgeries, obviously you don't do them in your office. You use the Dearborn Surgery Center?
Yeah, that's correct. So it's an outpatient surgical facility. It's across from Oakwood Main Hospital. It's a very comfortable, state-of-the-art facility where the patients feel very comfortable, where they're getting a premium surgical experience, but in a comfortable outpatient setting.
Much nicer than a hospital.
It's just much more comfortable for our outpatient procedures. The cataract procedure, for example, the actual surgery is only 10 minutes. So the whole time you're at the facility is about 2 hours. And the hospital is really for patients who are sicker, who need overnight stays, and that's just not the case with ophthalmic surgery.
Okay, now is that 10 minutes per eye?
Right, we would do 1 eye at a time. So the actual surgical time for the average cataract case is only about 10 minutes.
Amazing.
But the patients are at the facility for a few hours for us to get them ready and then, make sure they're safe to go home.
Now, generally speaking, like with insurance, if somebody has cataract removed, do they allow the lens replacement at the same time, or do they have to private pay for that?
No, the fee for the lens is bundled into the surgical fee. So the only time the patient may pay extra is if they decide that they want a premium lens, which is a choice that's available. But the standard lenses that we use in cataract surgery are paid for by the insurance.
Okay, and would that lens be good for a lifetime?
Yes, very permanent, very safe. It's really a
Wonderful.
very safe, and it's the commonest operation performed in the United States.
That's great to know. Okay,
All right,
let's get
so
going.
Let's talk about you.
All right.
So like I said, we screened you for glaucoma with the eye pressure test, and it was great.
Oh,
so,
I'm relieved about that.
No sign of glaucoma.
Okay.
And the vision was good. So now I'm going to look at the eyes.
Okay.
This is going to be really bright, Barbara. I want you to keep looking straight ahead for me.
Okay. Now, what do you see when you
So what I did first was I looked at the structures in the front of the eye.
Okay.
And now we're looking at the back of the eye. So I'm looking at your nerve and your retina. Go ahead and sit back.
And you can see that right through my pupil?
I can, yeah, because it's all
Wow.
dilated now. So this lens focuses the light on the back.
Okay, so are you able to see capillaries, the optic nerve, and everything?
Yes, I can show you with a model what we looked at.
Oh, neat.
Okay, so turn towards me.
Yes.
I want you to look up for me.
Okay.
That's perfect. That's excellent. And look to the right. Look down. And left. Great. Real healthy looking back there. Good looking retina. So we're looking at all the blood vessels and at the tissue in the retina.
Okay.
So the one part that looked a little abnormal, we can talk about it and then you can decide if you want me to do it over again.
Yeah.
The nerves, what we do when we look at the back of the eye, this is a model of the eye.
Okay.
Actually, that has an implant in it, so let's not use that one. Let's get our healthy one. So this is the cornea in the front part of the eye.
Yes.
And this is the lens. These two structures together, they focus the light on the retina, on the back of the eye.
Yes.
When we tell people about cataracts, that's where the lens turns cloudy. Your lenses are very clear. They're very normal for your age.
Okay.
So now when we go to look at the retina and the back of the eye, the first thing we look at is how does the nerve look?
Yes.
And it's one of the other ways we screen for glaucoma is to look at the appearance of the nerve. What I noticed with your nerves is I looked at the right one, it looked pretty good, pretty healthy looking. When I flipped over to the left eye, it just didn't look the same as the right one. It looked a little more suspicious for glaucoma.
Okay.
It doesn't mean you have it, but usually at this point in the examination, when I find that, I would want you to do some additional screening tests for glaucoma
Okay.
to make sure that there's no sign of it. So it
Fine.
would be a side vision test, and we also do a computer picture that will measure the back of the eye. So that's a much better baseline test than me just looking at it and thinking, well, it looks a little different. So that's where we are with that. So if you have time today, I wouldn't mind if you would do the test, or you can come back and do them a different
No,
day.
and that's fine.
It won't
because-
take that much longer, especially
Right.
now that you're dilated. We
Yes.
can probably get through them in 15 minutes.
Yes.
And then I can go over them with you and show them to you, and we can see what we need to do, if anything.
Yes.
Everything else looked perfect. So we also looked for macular degeneration. It was perfect.
Okay.
The blood vessels are very healthy. Sometimes we can see signs of diabetes inside the eye or high blood pressure inside the eye, and yours look perfect.
Wonderful.
So far, so good.
That's fine.
Just a-
I am concerned about the glaucoma because my sister's pressure is high. So I thought, that's one of the things. And once I had you on our Health Matters show, I thought, it's better that I go in because it's kind of silent and you don't feel anything, you don't notice any difference really in your vision. I thought it's very important to get in there. So let's just go ahead and see what we find.
Exactly. I think you've got the right attitude. The thing about glaucoma is if you find it early, it's very treatable, and it usually will never interfere with your vision, but we can undo damage that may have happened over years of never having it checked and not knowing you had it because you didn't feel anything. So
I
that's
hope our
why it's
viewers
so
are paying
important.
attention to what you just said.
It's just so important so we screened you, and even though your eye pressure was normal, we're going to take this a step further. We're going to see how thick your cornea is to make sure that we're really happy with the way we measured the pressures today.
Okay.
And we're going to check the side vision, and we're going to take some computer pictures.
Okay.
All right?
Let's go. We're in another office now. Dr. Akler found something that she felt was fairly suspicious since I have a familial trait of glaucoma in my family. So we're going to do a further test to take a look at that. Roxana, tell us a little bit about what we're going to be looking for.
Sure, Barb. What we're going to be doing here is that this test is called an OCT, and we can use this for a couple of different purposes, but for your purpose, we're using it for the glaucoma, and we're going to take a couple of pictures of the back of the eye, so we're looking at the nerve, and basically what it does is it images all the layers of the eye.
Okay.
And so at the end of all this, we're going to get a printout, and Dr. Akler will go over all that with you.
Wonderful.
Okay.
So we need the lights out.
We need the lights out. Thank
All
you.
right.
All right. So, Barbara, what we're going to do here in just a moment is I'm going to get you all lined up here, okay?
Okay.
And what I'm going to have you do is place your chin in the chin rest. your forehead all the way forward for me. And what I want you to do is I want you to just relax. There's nothing to this, okay? This is just like a big camera. So all I'm going to do is be taking some pictures of the back of the eye. You're not going to feel anything. What you are going to see in when you look right down that
look
tube.
at the red light?
Yep, I want you to look straight ahead for me. This machine's going to move in close. It is not going to touch the front of your eye, but I want you to look straight ahead. And then what I'm going to have you do here in just a moment is you see that green light off to your left? That's,
Oh, yes.
Yes, I want you to look all the way over to your left for me at that green light.
You want me? Okay.
Yep, that's perfect right there. Now I don't want you to move. Good. And what we're going to do here is we're going to take a couple of quick pictures. That's perfect. You're doing great, just like so. That's perfect. And Barb, in just a moment, you're going to see a bright light, and good. All right, so you can go ahead and sit back for a moment, and you can keep your eyes closed.
That was wild.
And what I'm going to do is I'm just going to review this test real quick.
That was like floaties, and it was kind of cool.
It's kind of like a little disco going on.
Yes, it was very, very much like that.
All right. So the machine is saving, and I'm going to take another picture of the eye here in just a moment. All right, so Barb, we're all set with this machine here.
Okay.
So what we're going to do is we're going to move you over to the other machine now.
All right.
And I will talk to you about this test in just a moment, okay?
Okay, wonderful.
All right, Barb, this is a visual field test. Have you ever had one of these before?
No.
Okay, so what this is doing is this is going to test your peripheral vision, okay?
Okay.
So we test this one eye at a time. So I'm going to put a patch over the eye that we're not testing, okay? So what I'm going to do is explain to you how this is going to work.
Okay.
And in just a moment, I'm going to get you all lined up in this machine and make you nice and comfortable, okay?
All right.
Your fixation target, there's going to be a yellow light that's going to go on in the back of the screen
that.
there, okay? And then what's going to happen is there's going to be white lights that are going to flash around this bowl here.
All right.
All of those lights are white in color.
Okay.
Some are very bright, some are dull, some are large, some are small.
All right.
Anytime you see one of those flashing lights, you're going to be holding this cute little clicker.
All right.
And you're going to click.
Okay.
Okay?
All right.
I'm going to give that to you.
All right.
All right. And I'm going to go ahead and put this patch on your left eye because we're going to start with your right eye.
All right.
And go ahead and close your eyes. I'm going to place that over your left eye. And what I'm going to have you do, yep, all right. So now let me fine tune you a little bit here. Okay, go ahead and put your chin in the left side of the chin rest. Yep, all the
Okay.
way over there. Forehead forward for me.
All right.
Good. Now what I'm going to do is I'm going to get you all lined up here. So Barb, what I want you to do is open your eye nice and wide for me. Good. I want you to hold it right there. Try not to move. Try not to blink. And the machine is locating your natural blind spot. And blink a couple times. And look straight ahead. That's good. Excellent. All right, now you can blink as you need to throughout the test. And remember, I want you to look straight ahead. I do not want you to look around for those flashing lights, and we're gonna get started. All right, Barb, one more measurement. I have another eye drop. I'm gonna have you look up towards the ceiling for me. Okay, so again, this is that numbing drop. So once I put it in, it may sting just a moment. There you go. And go ahead and blot your eyes.
Okay.
All right, and then Barb, what I'm going to have you do is just look straight ahead for me, okay? And what I'm going to do now is I'm going to measure the thickness of your cornea. And how I'm going to do that is I'm going to come in close with my machine. Again, you're not going to feel it because of that numbing drop, okay?
Okay.
So I want you just to look straight ahead for me, and I'm going to help you open up, and I'm going to come in really close. That's perfect, just like so. Good. And you can blink a couple of times. And I'm going to do the same thing to the other eye. Go ahead and look straight ahead for me again.
All right.
And again, I'm going to come in really close, just like so, and hold it right there. Perfect. All right. That's great. Okay, Barb, I have everything that I need.
All right.
I'm going to leave you right here, and I'm going to go get Dr. Akler. She'll come in and go over all these results
All right.
with you, okay?
Great.
All right.
Dr. Akler, that was very interesting with the little, like, not quite a strobe light, but does it measure all your peripheral vision? Is that what it does?
The machine has the capability of measuring your entire peripheral vision. With glaucoma, we're focused on certain areas that are a little closer in. And so we did your test, and there's a a program that's a screening test for glaucoma, and yours were excellent. So
Okay.
you did a good job. Your side vision was normal on these tests.
Okay.
That's your normal blind spot, so everybody has that, and then this was all good. So
Okay.
that's the first good thing right there.
All right.
The other test we did was we took some computerized images of your nerve, and what we want to do is have baseline measurements and also compare them to other people of your age and gender. So the first picture we have here, this black line is showing the measurements of your nerve, okay? That's your right eye and your left eye.
Yes.
The green shaded area are other patients in the database that are normal, and the red is our patients with glaucoma, and the yellow are borderline.
Okay.
So you can see that your measurements are falling right in what's considered the normal range. So that's a great sign as well.
Great.
So that's good. These other pictures measured some of the measurements of the nerve, and the right eye, our cup to disc, which is something that ophthalmologists refer to all the time, it was 0.469 in the right eye and 0.621 in the left eye. So you can see there was a difference. That was
Yes.
what prompted the testing. There was a bit of a difference in the rim volume too, which is something I look at, but it was a very mild difference. So I think overall, there's not a sign of glaucoma.
Okay.
We did do the thickness of the cornea, and it indicated that the eye pressures are accurate as we measured them. So the pressures are normal, and even though the nerves don't look the same as each other, at this point you're not showing any signs of glaucoma.
Okay,
So
so
it's
we can
good.
use this as, so for example, if you would recommend that I do see you every year.
Every year.
Okay, then we have something to look at so that if it changes, we know that further on down the road.
Exactly. So with glaucoma, things very slowly change. So if we notice any changes in the tests over time, then we may be more inclined to say, well, maybe at this point it is glaucoma and we should treat it. But right now, I think we can watch it. It's very possible your nerves have looked like that your whole life, and no one's had an
We
opportunity
wouldn't know
to
that.
look at them. So now we have the baseline measurements, and you can be reassured that at this point, I don't see any signs of glaucoma.
Wonderful, that's good to
So
know.
it's good news.
So overall, I would need to have glasses. Is that what we're saying here with my vision?
Your distance vision is it's right on the borderline of glasses or no glasses. So I think you could go either way. I mean, as you know, you definitely need them for the reading.
I do.
The distance, it would be sharper if you wore a pair of glasses, but I think, there are probably many times that you could get away without them.
Okay, now with contacts, could I wear contact lenses? Because I don't know that I would be wearing glasses a lot all the time. I mean, I do wear them when I'm at the computer, and I do a lot of computer work. But what would you recommend?
You could try them. We probably want to do a bifocal contact lens, and we can definitely set you up with some people that we recommend if you are interested in trying to be fit for them.
Well, actually, what I was thinking is, my son has a one that he puts in, and he leaves them in for 30 days. I was thinking maybe something like that, but other than that, if I can't do that, I'd
Then
rather have the glasses.
Yeah, that may not work.
Okay.
That may not work for you.
Okay, then glasses it is.
Yeah, but you don't need to wear them all the time.
Okay.
Just wear them when you.
Now, would they have a bifocal in them so I could
They
read
will.
with them?
Yeah, they will. So they'll have a mild correction for the distance, and
Okay.
then usually a progressive, so that there's
Okay.
no line in it.
Dr. Akler, one of the reasons I was a little bit frightened, and it led me to come in to have an exam, the older that you get, is it more prevalent? Is macular degeneration and glaucoma something you see more frequently as people get older?
They both are. So both of those disorders are more and more common as we all get older. So especially after age 65, we recommend yearly eye examinations so that we can screen for these conditions, because they are treatable, but you need to know if you have them so we can treat them. Cataracts, which are the other common cause of visual impairment in the elderly, they also become more common as we all get older. And in fact, a study just came out showing that patients who have had cataract surgery have less of a chance of falling and breaking their hip than patients who have it. So it just goes to show you, in our elderly population, you need to be screened for things that cause disorders of the vision, because that can prevent other devastating situations like falls.
Absolutely, and that is a major concern. Well, that's good to know because, you know, like as you said, with anything that distorts your daily life and with rugs and with things or objects that are there, absolutely. And I've talked to people who have had the cataract surgery and they didn't realize, because it's so slow over time, they didn't realize how bad their eyes had really gotten until after they've had the surgery, and they said it's just like another world.
Yes, that's so common. They just, like you say, the patients don't realize how poor the vision is deteriorated until they have it corrected, and then instantly, you know, it's rewinding the clock a lot of years for many people.
Well, there's no reason not to go in and have your eyes examined. So I'm hoping all of you are taking my advice and getting in to see that eye doctor once a year. I'd like to give a special thanks to Dr. Michelle Akler for allowing us to come in and do this show here today in her office. I'd like to also thank Roxana and the rest of the staff here. They've been more than wonderful. If you'd like to reach Dr. Akler's office, you can call 313-563-EYES. And again, thank you so much for joining us today for this special edition of Health Matters on the Road.